Welcome to the Be the Light Crown Edition podcast. I'm Hanna Fray, your host and pageant queen extraordinaire. Fun fact, while most people are resistant to change, I'm excited by it. So this podcast is designed to allow me to be the light for others. By sharing my experiences across countless topics where I demolished my fears, prejudice, expectations, and rebuilt brick by brick. My hope is I can encourage you to seek knowledge, implement change, and above all, trust in God. So let's get to it. It's time for some you time. Hello everyone. Before we dive in, I want to provide a quick medical disclaimer. So anything that you hear on these podcast episodes are not meant to be taken as medical advice. If you have questions about your own specific healthcare needs, be sure to advise with your particular healthcare provider, ideally a functional provider, but certainly wanted to make that clear. Additionally, I have also given each of my guests permission to discuss any historical health issues, questions, care that they have personally given myself or my children. So certainly they have that the ability to do so, as I think it's really going to provide you guys with some additional insights and value. So thanks so much, and let's dive right in. All right, everyone, welcome back to Be the Light Crown Edition podcast. Today is a very unique day because we have a guest on our podcast today. We have Dr. Stacy Fuller here. Hi, Stacy. How are you?
Excited.
Oh, I'm so glad. This is really fun. Like we talked about before we, officially hit recording, first guest for me. So definitely excited to dive in and hear more about you, hear more about your practice. As you know, you've listened to my podcast before, but for those who might be new, Be the Light Crown Edition is dedicated to just really sharing information and educating and inspiring folks to make positive health changes across their physical, mental, and spiritual health. So this mini-series is all providers. So this is the first one of 4. We'll have various health field-related providers coming to speak. I don't want to give away too much, so tune into the next episode for sure. But today, we've got Dr. Stacy Fuller. So usually how my podcasts are structured, I talk a little bit about like myself and my history, and then usually there's like specific segments, but today we're going to just ask you a lot of questions, so be prepared.
Hey.
But I do want to start off with our history because we've got some history, Stacy. Like we've known each other a while. And I had to think back, right? So I moved to Indiana in 2017. And I know I would have started, I've always seen a chiropractor. You mentioned you listened to the chiropractor episode I did, which is one of my very first episodes. So if y'all don't know, Stacy is also a chiropractor. So definitely go back and listen to that episode. She's got a small shout out there. But I've always seen a chiropractor. And so when I moved to Indiana, I had to find a new provider. And I started going to, it was Northwest Indiana Chiropractic, but they renamed, right?
Yeah.
Didn't they rebrand? Okay.
Yeah. He renamed it Modus.
That's right. I couldn't remember what the rebranded name was. Yeah, but that's what it was initially. But I don't know that I saw you at first. Were you always there or did you join later on?
So I was the first associate there. So I joined, I think it was like a couple years in.
Okay.
He had been at a couple different locations, but at that location, he had only been a couple months, I think, before I joined.
Gotcha. Well, and then of course I eventually got pregnant as well. And you were kind of deemed this like the guru of, chiropractic care for pregnant women. It kind of became your little niche, I feel like, which is where we primarily, spent some time together. And then you moved on and you started your own practice, right? You kind of moved into a new space. So tell us a little bit about that.
Yeah. So after about 4 years in practice working for someone else, I decided that my passion for helping moms and babies just was where I needed to go. So I ended up opening my own practice, which was awesome. I had that practice for about 4 years, and just recently I've switched to more functional medicine online now, which is awesome.
Yeah.
Kind of follows the journey, how you're supposed to go. So I still love treating moms and babies. That will always be my heart. When you help a mom, you help 2 people, because if the mom is pregnant, you're helping the baby too. And like, what a beautiful gift that you can give to someone. So I worked for someone else for 4 years, opened my own for 4 years, and now we're on this new journey.
I love that for you so much. And yeah, so you were, my chiropractor, so you adjusted me through pregnancy. You've adjusted my children as well, which I feel like is so important and probably scary for a lot of folks, but it was like my first inclination. No one else is touching my kids except for Stacy, right? So that was something that you did. And I also came back, I mean, even gosh, 2 years ago to that clinic, to the Mom Sense clinic specifically for the tongue tie and lip tie and breastfeeding assistance. So I mean, really, you've kind of been with me through it all, through all the kid phases.
I know, and I love that so much. It's such a special opportunity to get to work on a mom who's pregnant, and then all of a sudden you're holding that baby and it's like, "Oh my gosh, how did we get here?" Like, and now I see kids that I treated when they were babies and they're in elementary school. There's
Yeah,
no way, but
it's
somehow they,
awesome. I love that. And when I saw you as well before I left, you were pregnant, right? Because you now have 3 kids. So tell me about
yeah.
your family.
So we're fortunate enough to have 3 beautiful children. Third one was a little bit of a surprise, COVID baby. So that was actually kind of the turning point for me really pushing into functional medicine. While I was pregnant with her, so she was born in May of 2020. So like
Right.
all of COVID just happened. And
Truly.
I getting confused like a lot of people were with what was going on in the world, and it just kind of drove me more internal to look at my own health. And I started realizing that despite feeling like I'm very healthy, I exercise, I eat clean, there are some things that are off, and they've probably been off for a really long time. And if we don't address them now, they're really going to be, the downfall of my older years. I don't want to not be able to play with my grandchildren. I don't want to be a burden on anyone in my family because I can't take care of myself. So I started pushing, into more functional med, learning everything I could. And that is what drove that path. But it seems to always be my children that kind of push me where I'm supposed to go in life. Um,
Yes.
this was my intro into pregnancy and postpartum care. Being pregnant with him, I was like, wow, there's like not anything here for me. To be
Yeah.
honest, sorry, a call came in.
All good.
I lost you. To be honest, when I was pregnant, it was hard to find someone that was willing to adjust. Chiropractors were kind of scared to adjust a pregnant woman. There were fears that like you could put them into labor, or what if something happened. None of which are very validated. I mean, chiropractic care is extremely safe and very helpful during pregnancy. But I was like, man, I've never been as uncomfortable as I was when I was pregnant. So never in a time
Right.
of life did I need more care than that.
Yeah, I totally agree. And, I've only been pregnant twice, but of course, both times I received chiropractic care. And I think the second time I knew what to expect, right? So the first time I didn't know, I couldn't have known like a before and after experience of like having chiropractic care and having a birth and then not. But I mean, both of my birth stories were pretty amazing. Not, knock on wood, 2 for 2 is pretty good, like no issues. And I really attribute that to the attentive care that I received up until like the day before, and I was induced with both. So to that point, it doesn't necessarily induce labor, but it's just that your body, is ready when it is time to do what it needs to do. And likely you'll have a better experience. At least that was in my case. So
Yeah,
totally
absolutely.
agree. And
Yeah.
just wanted to call out as well, like your kids being the driver for you to move into more of like a functional provider space. We have a similar story, and I've shared this on my podcast as well. Like the whole reason I got into the rabbit hole, and you and I've even come, full circle back into working with each other, is the same reason for, my oldest having severe eczema, and my youngest had, having asthma, and just like searching for answers. And I was just reflecting on this because it was on Halloween, or just right before Halloween of last year, that he had that full body flare that kind of like started the whole thing. And so not even being a full year in, and
Yeah.
starting like not having no awareness, to not even a year later, like I've got a podcast dedicated to educating others, is like just such a full circle moment for me. So can totally relate to like our kids driving, I mean, good outcomes for us and ultimately for them as well. Yeah.
Yeah. The major turning point for me with the functional stuff was what I ended up doing a continuous glucose monitor. So
Mhm.
I don't know if you're familiar with those, but like it's a monitor that goes in your arm. It measures your blood sugar every 15 minutes. You can scan it with your phone and get feedback on what's going on. And the
Okay.
biggest, like, okay, I have to make a shift. This is the information that people have to know. We cannot go on like pretending this isn't happening was my son had a basketball tournament. So they won, which is awesome. So like the tournament went all day.
Yeah.
So done, we went to Dairy Queen to celebrate, you know, as people do. And I got a mini M&M Blizzard. I ate half of it and my blood sugar went through the roof. I was horrified at how bad it was. And this thing that really, really got me was the person that ate the other half was my 2-year-old. So what did that do to her body? And it's kind of like once you see it, you can't unsee it. So then every time I eat something and that glucose monitor went off the roof, I'm like, well, what happened to my child who's, you know, a fraction of my size? Like we just have better. And I wasn't fully aware of it until I saw those numbers. Just like you weren't, you know, fully aware of everything until Everett was really struggling. And then you can't not see it anymore.
It's so true. I mean, I haven't yet spoken to someone who's kind of dove into functional medicine, or at least started researching like toxic loads and things like that, and gone back the way and thought, no, it's fine. I'm just going to go back to my old lifestyle. Like it doesn't work that way. And I think there's that in and of it's proof in the pudding, right? So,
Yeah, absolutely.
love that. Well, so I've already talked a bit about why, you know, into getting into functional medicine. But would just love to hear, you've been in it for a little while now. So would love to hear like your overall, I guess, like elevator pitch to folks who might be on the fence as to like what's the draw? Like what are the benefits? Like why folks should maybe just start to consider maybe the more reactive, like Western medicine approach might not be fitting the bill for them. And I know that's a very broad question, but feel free to take it how you'd like.
That's okay. So that's like the big question, right? Because the problem, not the problem, but one of the challenges with functional medicine is that it's not covered by insurance. I know there are some providers out there that are billing some insurance for it. I'm not sure how that's working out, like the time and the energy that goes into it, like insurance just isn't going to cover that. So that seems to be a holdup for a lot of people, but that is the why on why you would do functional over something else. Our healthcare system is so dictated by insurance. On average, a provider can spend about 7 minutes with you. I mean, I don't know if I can get through what happened to me the past year in 7 minutes, let alone my whole life. That may be impacting what's going on in my health right now. My blood sugar did not become unstable overnight. It wasn't unstable from one ice cream, half a blizzard. It was years of stuff that I was doing. So functional medicine is amazing and worthwhile because it takes that deep dive. It doesn't just look at managing the symptoms, which is what a lot of traditional Western medicine does. Not saying by any means that we don't have a place for that. We absolutely do. If my kid breaks his arm, like we're going to the ER. I'm very grateful to have an emergency physician who knows how to set a bone. Contrary to what people think about chiropractic, I'm not fixing a broken bone. That's not my jam. But when we're looking at chronic issues, things that are affecting multiple systems of the body, we can't do that in 7 minutes. That's not a quick snapshot of like, okay, this lab is fine, this lab is not, this is the diagnosis. It has to look at the whole person, which takes time. It takes time and it takes energy and it takes really commitment to changing. You know, one thing didn't get you to an unhealthy place and one thing isn't going to get you better.
It's such a good point. And because I reflected on this as well, a lot of like, what is the why? Like, how did we get where we are, you know? And that's like, we could do a month-long series about the trajectory of the hospital systems in the US and whatnot. But I think a large part of it is like this instant gratification that touches lots of, you know, parts of our lives. It's not just like the healthcare system. It's truly everything, but we're like conditioned for like this instant gratification, and it bleeds into take this pill, feel better immediately, or take this and you'll be fine tomorrow, or, you know, 7 to 10 day course of antibiotics or whatever it is. And so that's kind of where I felt like the folks that I relate to, where some of the issue is, because like I said, Everett's issue started in October. We're about 85% healed. And like you and I know, we've got a little bit more to go. And that's almost a year-long journey. Lots of time, lots of money, lots of research. Would I change it for the world? Absolutely not. Like I've learned and grown so much. But it's not, it's the you know, the flip side of that is the conversation I had with the allergist and with the dermatologist was take this shot, he'll be better in a week.
Right.
give him a shot once a month and you can cure him. And that's just simply not true. But
Mhm.
it is appealing. It's appealing, you
Oh,
know?
heck, yeah, I would like to take a pill and have all my problems gone,
Yeah.
but I've never encountered, honestly, any situation in life, like you alluded to, where it's that simple. The good things are worth the hard work, and they
Yeah.
are hard work, you know? If it were easy, everyone would be doing it, and the state of our health wouldn't be where it's at.
Yeah. And I think too, we can all relate to family members, maybe, loved ones, parents who maybe aren't aging that well. I mean, if we just look at the statistics between you and I, one of us has an aging parent that's got 3+ prescriptions or is in poor health, right? Just on stats alone. And I'm sure I mean, I know for me, that's certainly the case. And it's just not the life that I want for me or for my kids. And not that they intentionally wanted to be there either. It's like everything's failed us. Like the system's failed us and education has failed us and things are just getting harder. The food isn't the same that it was when they were growing up. Medicines aren't the same. And so it's just that's motivation for me, right there and there. We just want to be healthy for our kids.
Yeah. Well, and speaking to more of that, it's people our age, and you're younger than me, but like my age bracket, like most people I know are on a medication that they
Mm,
will be on kind of indefinitely, like they're already like, "Oh, I'm old." I'm not 40 yet. I'm not old. This is like the
yeah,
middle of my life. So
right.
if of giving up now and saying, "Well, we'll just take this medication," you could be taking it for 40 more years. Like, that's not what I want, and honestly, that's not cost effective. Even if your insurance is gonna cover XYZ, if you add that up, if you live a healthier life, you will pay less overall for your healthcare. But
I think that's a
upfront,
great point.
for a visit, it may seem like more in the beginning, but after you get shuffled from one specialist to another, I mean, think about the time that it took you 3 months to get into that GI doctor, the
Right.
time that you had to take off work to drive to the appointment, to sit there, for them to say, well, everything looks normal here. We're going to send you to this guy.
Hmm.
Functional med is an investment, as you know, but you're
Right.
going to walk away with at least some understanding of how you got where you are and where you need to go next. You may not be better, like you said, in a week, but you will have a path that you can feel
Mhm.
confident you will be better eventually.
Yeah, and you will see results. I mean, that's
Oh,
like,
yeah.
I obviously can't speak to everyone, but I know that I have with the things that I've worked through and with my kids. And even my youngest, Kellen, who suffered from asthma, I mean, he was having like severe issues. He was hospitalized once. And since we've gone through a lot of his protocols and reduced our toxin load, he hasn't had to use his nebulizer once. And like COVID and strep and all these other things are running rampant through his daycare right now. He's home this week with diarrhea, but like he is literally the happiest kid running around laughing. Like he's fine. I'm the one with a cough, like a little bit of a tickle in my throat. He's completely fine. And so he should be the one. Normally, this would be where we're like worried about hospital visits, right? Same time last year. And he's just doing so much better. So definitely is worth the investment. And I think an additional call out to cost, because I can relate to that, right? Like just everything's more expensive these days. And, most of the work I've done in the past year hasn't been covered by insurance. But just think about like from a retirement perspective. So I've been doing a lot of like financial planning for retirement. What is the point? What is the point of having all this money saved for retirement if when you retire at like 65 or maybe you have to wait till you're closer to 70, you can't do anything with that money because all your money is going to round the clock care?
Yeah.
I just,
Or all your time is going to appointments. Like, I can't take
yeah,
this trip to the Bahamas with my husband because I have this doctor's appointment.
right.
I mean,
I,
it's not just the number of years, it's the quality, and that is what taking care of your health younger does for you.
yeah.
Or older. You're never too late.
No, I totally agree. So that's our soapbox on it's worth the money. But I mean, I think it's worth addressing though. There's already a lot of variability in this market. And so there are already differentiators and like boutique functional medicine. And there's these packages and, programs, and just make sure that you are still doing your research with your functional providers too. Someone that you want to see them consistently and work through your protocol with, and not sure what the outcome's going to be, not sure what you're paying for. Still do your research. And I mean, I can vet Stacy, Dr. Stacy Fuller's got a great program and a great package you guys can purchase to work with her if you're in the right area. But I've also seen, especially with diving into the eczema like world, which is like a whole nother like universe of crazy out there. There are people that'll tell you, $500 an hour for a consult, and they'll sell you this miracle thing. You still have to be careful, but just know that there's a lot more value in the functional space than I've ever experienced with any other type of medicine or provider. So that's my 2 cents on that. Let's talk about something maybe a little more fun while we have a moment. So I'd love to hear just like your favorite health story, whether it's like sentimental or just kind of fun, or maybe like a fun win, if there's anything you can share without giving away too much, information. But
Yeah. So the best stories, one in particular doesn't like pop out to me, but like the absolute best stories are when people will come back and be like, and this was more from the chiropractic world, but they would come back and be like, oh my gosh, I had the easiest birth. Like I got done and I was like, that's it. Like people made this out to be so terrible. And like, it was really fine. I felt great after. And they credit me with it, which is so kind, but I didn't do it. Like you just did that. I guided you in that process. And then the other thing that's like so amazing is when people come back and you have helped their infant who has been struggling. Because if you can help that infant, you have literally helped the whole family. Because if that infant's not uncomfortable and crying all the time, then the older kids get some attention. Then mom gets to sleep for a minute. Someone can actually take the baby so that you can, I don't know, like shower, go to the bathroom, drink
God
some
forbid,
water,
right?
like, all those luxuries in life. So when people come back and they're like, my kid is a new kid, I don't know what voodoo magic you did, but I'm so happy we did it. It's like, okay, thank you. That's the point. We're just trying to chill them out, just trying to take away anything that's blocking them, that's making them not feel their best, because they have one means of communication. So people coming back and having those huge life shifts, it's so much more than cracking someone's back, than putting them in alignment. If you are uncomfortable, in pain, scared about delivery going poorly because maybe you had a bad experience before, giving people those positive experiences, it ripples through their whole life, which is really amazing. And I'm always so touched and excited to be a part of someone's journey. As you know, as a woman, like you will tell your birth story the rest of your life. I can picture myself as a great grandma, like sharing it with my grandkids, So to be a part of that aspect of someone's life is so beautiful and such an honor. And to do it in a good way, where it's a positive memory when there are a lot of bad, experiences out there, really, it makes me emotional.
Yeah, no, I love that. I mean, I vividly remember Stacey, I still have my medicine ball that you made me buy, if I'm not mistaken. Like it's literally right here.
Good. Never get rid of it.
Yeah. And I mean,
baby.
I mean, no more babies for me, knock on wood. But I mean, I remember you sitting on your ball and like showing me exercises. And it's so, to your point, it's so much more than, from the chiropractic side, so much more than just like getting you into alignment or popping your back. Like you did a great job. And anyone listening, that's what I would encourage you to look for as well in your provider that you're seeking out. Are they also giving you things to work on at home? Like, are they talking, well, how does this feel? Then do this stretch and see if that helps, in between appointments. I mean, we walked through like birth stances together. Like I remember like, on the floor, right? Like you could try it this way, you could do it this way. Of course, I ended up getting an epidural because I wimped out a bit, but we talked through those things. And so it was just such a good experience. Just for the record, if you don't mind, I would love to just, if you could name like some of the things that folks come to you for adjustment of newborns, because that might be something new. And I talked about it very briefly in that one episode, but I would love to just hear from a chiropractor, like what are some of the top things that folks come to you for, or that you find adjustment at a young age can help solve for?
Yeah, so there's not any real negative to adjusting a newborn. People hear adjusting a newborn and they think I'm gonna like twist their neck around or something crazy. I've actually noticed that the dads are more worried than the moms, which is very interesting because the dads don't often come to the appointments, but they're very about it. So adjusting an infant, it almost looks like nothing. I mean, it's the most gentle guidance. Like usually when I'm done, people are like, did you do it yet though? Like go ahead and do it. Like we're comfortable with you. And I'm like, no, we've been doing it for 10 minutes. You just didn't notice.
Yeah.
For sure, tongue and lip ties. If your baby has any kind of feeding issue and you're not seeing a chiropractor, you're prolonging your journey.
Mhm.
Because the easiest way to describe it is if you have a tongue or a lip tie and you cannot functionally extract the milk, whether it's from the breast or the bottle, the way that you need to, then you will pull with any muscles you can. Their drive to feed is so strong, that's literally how they're going to survive.
Mhm.
So, what they will do is if you imagine sucking like a really thick milkshake through a straw, that's what they're going to do. Think about where you strain. You strain in your cheeks, you strain in your neck, and
Mhm.
all of that tension builds up and makes them uncomfortable. So even if you get the ties revised, if you're not addressing those compensations, they might keep doing those patterns.
Yeah.
For sure, twin babies, like you should be adjusted when you're born. There is
Mm.
not enough room in there. I've never treated triplets, but like I can only imagine
Yeah.
face issues with that. But
Yeah.
you can be in awkward positions in utero. The way that delivery comes out can be challenging. For sure, C-sections are not the same as vaginal, not
Mm.
saying that they're not life-saving and we need them, but like it's a different anatomical process that puts different strains on different parts of their body.
Mhm.
From more of like a condition standpoint, constipation, reflux, things like that, they're really impacted by making sure that everything in the body is moving the way it should. The
Mhm.
wonderful thing about chiropractic care and functional medicine is that one thing affects a bunch of things, right? The body is all connected, and the goal for both of those practices is if you improve in one area, you can improve in multiple areas from the same treatment, which
Yeah.
is pretty opposite, the allopathic community, which is Western medicine, where they're going for like one drug for one target.
Yeah.
And then they create ripple effects, but not necessarily what they were hoping.
Yeah.
So, yeah, so
That's
chiropractic,
great.
don't be scared. It's really not scary, but make sure you go to someone who knows what they're doing.
Yes, and I think but it's funny how the chiropractic it's gotten better, right? But the chiropractic community has been like crucified a bit more than others. But it's like, aren't there you can go to a bad tire tech and your tire fall off. Like you know what I mean? Like you've got to do your
Yeah,
research with literally anything that you do. It's no different with chiropractic, providers, obviously, but it has to go without we have to say it apparently. So yes, do your research, but I don't know how people go on in their whole life and like never get adjusted. I mean, their body just compensates in really weird ways and then who knows, but
yeah,
yeah, and even with
for-
like with Kellen, I talked about he had torticollis and like I instantly recognized that and now he's super straight and great and thriving and who knows what would have happened if I hadn't because even the pediatrician was like, I don't see anything wrong here. I'm like, no, I know.
yeah,
He's literally like this. He's
right.
literally like this. Like that's
Yeah.
not normal. So
Well, and you make a super great point. Like, no one knows their child more than the mom.
mm,
I mean, dads know too. I'm not saying they don't, but
yeah.
like, you know your body and you know your child more than anyone else. So there's no set of letters behind anyone's name that makes them more of an expert on their child than you. Your provider is spending, like I said, on average 7 minutes with them. So
Mm,
maybe they didn't have their head twisted for those 7 minutes,
right.
but they do the rest of the day at home. Like, you're not wrong. If you feel
Yeah.
something in your gut, then it's just not the right provider. Everyone's not your friend. Everyone's not your person in life. You have to find the people that support you in all the ways. And one of the ways to support a patient is to listen to them, to take their concerns seriously.
Yep. It's such a great point. I think that especially I mean, I don't know if there's a correlation to like underserved areas or, geographically north versus south, but I just find there's sometimes an over dependency on folks who, like to your point, have letters in their name and for a good reason. Like y'all went to school for a long time and you're well educated, but it doesn't trump the parent card and it doesn't trump your instincts. And it has to be a balance between the two. So one point I make on this podcast is to like ask questions. Like it doesn't have to be rude or disrespectful, but like they should want to have positive conversations with you, even if your viewpoints are different. And if they don't, to your point, like, then maybe you should seek out another provider. You should
Yeah.
feel valued and listened to in your healthcare appointments.
Yes. My number one tip for picking a provider would be, how is their response when you do ask a question? If they're annoyed by it because they're trying to get on to the next, then they're not really invested in what's going on with you, and you need them to be. And from our appointments, like, if you ask me questions, I will get off on a tangent. We will be an hour late. It will be a problem. Everyone will be mad at me because I am so behind. But like, those are the moments when you're changing lives. That's when you're really getting to someone and they're going to make the changes, and health will come from that.
Yeah, such a good point. I'm excited to continue working with you on Everett's eczema journey. So I haven't given my listeners much of an update in a little while. So I'm imagining I'll do a whole podcast on that. But we're just so close, and I want to be able to, like, formally close that chapter and just give people some really great news. So for those listening, though, we're on to the final stages of his healing, and I'm working with Dr. Stacy here on that. So more to come. As we're kind of nearing the end here, just a few more questions if we can fit them in. So, what do you think is the best thing that folks can do to protect their health long term? And I know we've kind of hinted on it, but just to kind of get your perspective from both a chiropractor and functional provider perspective.
Yeah. So when we're looking at any kind of chronic illness or long-term problems, which is mostly what functional med treats, we're not going to treat like an acute cold or something. I mean, you would spend the money and the time on that. Really, blood sugar stability is at the core of all of it. Metabolic health is how our body responds to any kind of changes or challenges, stressors in the world. And it's estimated that like upwards of 94% of Americans are metabolically unhealthy. And one of the big risk factors for that is blood sugar instability. So that's one of the diagnostic criteria for that. So when your blood sugar is unstable, you cannot have health in any real way because it affects everything. It's going to increase your inflammation. It's going to affect your hormones. It's going to affect mood, sleep, all of it. I mean, you will literally start to break down how your gut absorbs food if you have too much insulin resistance, because you won't be able to pick up the glucose the way that you should. It's going to be hanging out there. You'll get increased belly fat. So there's not any chronic disease I know of that isn't positively impacted when blood sugar is stabilized. Doesn't mean it will heal everything, but there's nothing that it won't help with, at least. And there's no downside to stabilizing it. Like, getting it stable doesn't create another issue as maybe a pharmaceutical would,
Right. I mean, what pharmaceutical drug doesn't have a laundry list of side effects? It blows my mind. Did you know that, like, we're one of 3 countries, like first world countries, that even allows pharmaceutical drug commercials to play?
So
Like,
I
no
thought
one.
of 2, us
Oh,
in
is
New
it 2?
Zealand. Yeah.
It may be 2 then. Yeah. I mean, like, why? Like, why are we? And then you listen to the side effects and it's like cancer, death. I'm like, I understand that's a really low occurrence, but like, have we tried anything else first? Like, it's
So
just
super scary thing too, because like as you deep dive into all this stuff, you learn more and more, right? Some of the side effects of drugs are literally what they're trying to prevent.
absolutely. They're literally a side effect of Dupixent,
Yeah.
which is the injection for eczema, is eczema.
So make it make sense for me, Hannah. Like, why would we do this?
I literally, I had a conversation because, like, I mean, I'm educated enough to be dangerous. I don't claim to know everything. I still have to like hire people like you to, help get to solve things for me.
No one knows everything. Thankfully, that would be a weird person to talk to.
This is true. But when I was speaking to, Everett's dermatologist, and they were trying to push Dupixent, it was that conversation. And I tell anyone this story that'll ask. He said, "There's no downside, and it'll cure his eczema." And he kind of was like shaming me a bit. He's like, it was whenever he was at his worst, and you've seen those photos where it was just like, he's like, "You're prolonging his suffering by not agreeing to this treatment for him," was pretty much what he told me. And I said, "Okay, explain to me how it works." So he explained like the pathway and what it was suppressing and all that. And I said, "So you're telling me that there's no downside to suppressing the eosinophil production in his body," which is the pathway, by the way. I said, that can't be true because it's there for a reason. So if you suppress that, what's going to happen? And he was like, oh, well, technically, if he were to get like an infection of this or parasites or all this, he wouldn't be able to fight it off. I said, so you're saying there is a downside. And he wasn't going to give me the full story
Yeah.
initially, you know?
Yeah.
So
So
that's
like
just scary.
what is consent then? Like, do we even have it anymore?
In my opinion, I was absolutely not informed. That was not informed consent.
So
Yeah.
then you take someone who maybe doesn't have the background you have, hasn't had the time to do the deep dive, and they go in there and he gives that to them and they're like, there's no downside. So then you start to see symptoms later and the pieces are never put together because the parent thinks, I never did anything that could potentially cause an issue. So you
Right.
literally can't even trace the crumbs back to the origin because there was no origin in your mind. People
Yep.
don't magically wake up with eczema. They don't magically have type 2 diabetes. Like there is a path that takes you there. And if we're unwilling to acknowledge the things that lead there, I mean, you're never going to heal. Not really.
No. And that's why this is such a broken system. Because to your point, it's not being traced back. So we're not getting the full picture. And I have a friend who same thing. Her son got put on Dupixent, and she's even mentioned like health issues with her kid. And I can't say anything because I don't want her to feel bad about her decision. I'm just like, here's my podcast and listen
Yeah.
to my,
Yeah.
but that's about all I can do, and it's just like, what,
Yeah.
what do you, why, it's heartbreaking actually. And what we're doing, what we can, right? We're here today,
Yeah.
we're recording a podcast. We're hoping that folks can hear it and listen and,
Yeah.
and make some positive changes. So,
Well, the thing is, like, parents, if you've done something that you wish you hadn't do, because you and I have talked about this a little bit, like you wish you could go back in your parenting journey and not do certain things. But
yes.
I I used to be a mental health provider, so I have my master's in counseling psychology as well, and I actually did parenting classes for a minute.
Mm,
I met bad moms. If you are trying to help your child with an illness, you're not a bad mom. You didn't make a misstep. You didn't have the proper guidance that you needed, but like those are not decisions that are ever made not out of love. So you have to kind of forgive yourself for a minute because your friend is doing exactly what she thinks is the best, which
absolutely.
it is to the most that she can do. Hopefully she, realizes some other things are going on, but it's very hard when you realize like, man, maybe I kind of set my kid up for this or I set myself up for this and I wasn't trying to harm my child. And we're not saying that you did, but
Right.
we're saying that we need to step in a different direction now. But there are bad moms out there. If you are doing anything because you love your child, it's never a bad decision. It's never a wrong decision. It just may be one that we need to change.
Yeah, that's such a great call out, and thank you for bringing that up because I've obviously felt the exact same way. I've been in full blown tears over, the decisions that
Thank-
I've made, and I still to this day cringe that they give my son a freaking not popsicle, I can't sucker or Smarties every dang day after school, and every day I sit here and I bite my tongue like it's just a sucker, but it's the guilt, it's just compounding, and for
Yeah.
someone like me who's type A, it's just the control freak aspect of it because once you see it, you don't unsee it.
Yeah.
Don't think I haven't considered buying some of the Yum Yum pops though and dropping them off that are dye free. I'm like, I could do that if it really, I
I've
mean,
done it.
see?
And
Exactly.
you know what happens is that other kids are like, oh, can I have that sucker? And you're like, cool, yeah, I'll bring some for you. Because
Yep.
everyone wants something different. Like kids don't know. So they're
No.
just that there's something new. So almost
Yep.
sets up where like your treat is the better treat because it's special and it came from somewhere else and like only one person gets it. So
Yeah.
it's not always bad to be different.
Yeah. Such a good point. So, kind of talking a little bit more about the healthcare system, because you've done a little bit of, all of it, and now obviously you're private pay. What is your biggest annoyance or pet peeve with the healthcare system in general?
Yeah. What a loaded question.
I don't gotta pick one. We can't. We don't have time for all of it.
One thing that so it affects functional because I don't take insurance, but it really, really affected chiropractic care. Insurance should not be dictating care. These are not people with medical degrees. These are not people that have worked in the medical system. These are
Mhm.
people who are just following orders from a higher power that's goal is to make money. So when I have, like for chiropractic, if I had a patient who was really struggling, but they're getting better, so we're spacing out care, insurance will stop care. They'll stop paying for it because they're like, well, they're not coming frequently.
Mm,
Isn't that a good thing? Shouldn't they not be coming frequently? Like they're improving. So they will actually stop providing care because they're like, well, they're fine. I'm like, well, they're gonna not be fine because you're gonna stop care. And then they say, well, then submit a new issue. We'll restart and you can do something else, which is mind blowing. And so for functional medicine, they would never pay for it. I mean, if I spend 2 to 3 hours combing through all of the history of a patient, trying to put all the pieces together from the physical, the mental, the emotional, because it all has an impact on the body and what's going on,
mm,
insurance is never going to value that time. Like they're just not.
yeah.
So that is why people practicing functional medicine that are charging insurance, I'm not sure how they're doing that.
Yeah.
If doing it and they're doing it well, more power to them. Feel free to DM me and let me know. I also do that for my patients. Because we pay an
Yeah.
astronomical amount for insurance and then we can't use it everywhere we want to use it. And even when we can, they're still deciding the care.
Right.
Doctors should be deciding what the care plan is, what the frequency of care is, what the type of care is. And unfortunately, like that does not happen in our system. And that is extremely frustrating because you're paying for it. You're paying for it whether you end up using it or not.
Well, and but they're out to make money, right? Like it's a revenue generating system and it's not transparent pricing either. So
Right.
that's my hope. I would just love transparency and pricing. Like that. Let's just start there.
Yeah.
That'll, then you've got competitiveness in the market, right? Like it works in almost any other system that we look at. So,
Yeah.
but I digress. Yeah, it's not my
No,
problem to fix. So,
no, but so from a provider standpoint, because I actually don't think a lot of people understand this, so I'll be brief with it, but I'd like to bring it up.
yeah.
Insurance companies decide how much they're willing to cover. So they can change that at any time. So like I could be seeing patients and they will reimburse me, say $25 for a visit or something.
Hmm.
The next month they can send me a letter and say, you know what, we're only paying you $20 now. And I can't do anything about it. Like that's what they're
Hmm.
going to pay me if I have
Hmm.
to, if I want to be in network to be in their insurance. So the other thing is I can't then go back and ask the patient for more money. So when
Right.
you start seeing great providers who you love for years and now like they don't spend any time with you, appointments are really quick, they're seeing a million people. That's part of the reason why. It's not that they don't care and they're not a good provider anymore, is that they're literally making less for the same amount of work. So they have to see more people or they're not going to make money. And it's not make money to buy a BMW or
Right.
like a gorgeous home. It's like make money to pay back your 6 figures of loans that you had to take out to become a doctor because
As
the
you
loan.
should. Yeah.
So it's just something that I don't think people understand. Like
Mm.
we're not trying to gouge you. Maybe some people are. Probably some people are. Some people have really nice homes and really nice cars. But like most of the time, you're just trying to be compensated fairly and you don't have any say in it, which is very hard. And that's also why some providers don't take certain insurances. And it's frustrating as the patient, it's frustrating as the provider.
I think I'm so glad that you shared that because I mean I had some insight into that, but it's not for lack of asking questions and just being
Yeah.
involved in the space for a while. And it's hard to remember to look at things from somebody else's point of view, right? So such a great call out. With our last question here as we're wrapping up, I want to make sure you have an opportunity to share about your current practice. I mean, I know we just announced that you're also doing some chiropractic care again, which is exciting. So tell folks where they can find you, how they can work with you, what you like to work with them on, and also include like locale information if that's important, because we have folks listening in every state. So
Yeah. So my own practice is functional medicine. So in the state of Indiana, I'm licensed to practice functional medicine through my chiropractic degree. And then if you're in a different state but you want to get some of that, we can do an alternative version, which is health coaching, which I could legally do in any state. And you still get kind of the expertise of my background. I'm not going to not tell you something because you're in the health coaching world, but it allows me to not have to be licensed in every state, which is awesome. So all of that work is done via telehealth, which offers a lot of benefits. So one, if you have something come up or an illness for your child or you, like, we don't have to worry about canceling an appointment over that. If you're worried about cold and flu season, like, you're not taking your new child out of the house to be able to do it. It makes it a little bit easier. It also keeps costs down for my overhead, which allows me to provide services at a lower price point, which I think everyone appreciates, I would think. So
Yes, for sure.
all of that information can be found at inspiredhealthllc.com. That is our website. And then you can, book send a message or whatever to book an appointment on that. You can find me on Instagram at Dr. Stacy Fuller. So trying to do more on Instagram and less on Facebook. Facebook is Inspired Health LLC. Instagram's hard though. Like, it's hard to get those views, but I would prefer to be on Instagram. And then I just accepted a position at a local chiropractic office. So if you're in Valparaiso, Indiana, regional spine and sport, I will be there one day a week so I can keep helping the moms and babies. Other patients too, but the moms and babies have my heart. So I'll be there one day a week doing chiropractic care, which allows me to basically do everything I like to do.
Yeah. I'm so excited that you have that opportunity again. I know how much you love it, and you really are a guru when it comes to taking care of that demographic. So exciting. I will include all of those resources and the website link and all that in the show notes so folks can easily find it. And of course, it'll be all over our social media. I mean, again, I can speak from experience. I've literally worked with Stacy in almost every capacity at this point. My chiropractic care, my kids' chiropractic care, like dealing with long-term illnesses. And now she's seeing, Everett virtually through that health coaching option. And so I just, if you need a great provider, well, actually, don't make her too busy because I kind of need to have time to talk with her. But no, she's great. So Stacy, thank you so much for coming on and being my first guest, and just so grateful that this journey that we've had from Indiana to Mississippi and even flying back with Kellen to have the long tongue, I can't say it right, tongue and lip tie revision. It's just been really cool to see how that friendship has kind of changed over the years, and how you're serving our family still to this day. So just can't thank you enough for all of your expertise.
Oh, it's my pleasure. And thank you so much for letting me be a big part of your family. Like, what a gift to be invited into a family and get the greatest compliment is when someone wants you to treat someone else in their family. Cause then you're doing something.
That's the key. And I trust you with my kids. So
yeah,
there you go.
I mean, what's bigger than that? But thank you so much for giving me the opportunity to share about functional medicine. I think that people are a little bit confused about it at sometimes. And I really appreciate you doing this so that people can learn more.
Yeah, absolutely. Well, thank you again so much. And guys, don't forget to tune into the next healthcare provider series. We've got 4 coming at you. There will be another one posted once this one goes live. We'll do 2 on Friday and then 2 the following Friday. Be sure to follow Dr. Stacy Fuller on her Instagram. And if you're interested in booking, go to her website. And thank you again so much. All right, we'll see you next time.